Tens of thousands of chemicals are used in workplaces without proper tests for effects on health and the environment. Around 248,000 substances exist in the market, but there's only information available for around 6,000 of those. That means less than 0.15% of chemicals used in our workplaces have been properly tested for environmental and health effects. It's no wonder that a person dies from exposure to toxic substances at work every minute. Every minute. But that's not the whole story. There are 160 million occupational illnesses per year, and the bulk of these are caused by chemical agents.
Several studies have documented that over 80% of all workers that die as a result of their work die of occupational disease rather than the sudden violent accidents that we typically hear so much about. If you're talking about occupational disease, it's obvious that most of those are caused by exposure to hazardous substances, such as dangerous chemicals in the workplace.
The fact is that we do not have proper statistics.
What is revolting for the ITUC is the absence of figures. The fact that today we are in a world where policymakers do not have reliable statistics to know what are diseases, what are deaths related to chemical exposure. So without those figures, we cannot have sound policy making, and this is a terrible situation.
Yet this lack of information shouldn't prevent us from acting quickly. If we are going to stop the bleeding, we must act now. At the Johannesburg Summit in 2002, governments endorsed a goal which is vital for workers everywhere. By 2020, all chemicals must be produced and used in ways that minimize significant negative effects on human health and the environment. Unions want governments to honor this commitment. They have concrete ideas to help achieve it, and they want to be part of the change. Where can we start? We must eliminate the most dangerous substances. Banning asbestos. Asbestos is the biggest industrial killer and causes more than 100,000 deaths per year. In the case of asbestos, its association with lung cancer had already been described in the 30s, but it took over 50 years to start banning it in some countries, and regrettably is still used in many countries. A handful of countries concentrate production and block international banning.
We're campaigning very hard on asbestos. The best way to remove the hazard of asbestos is, first of all, to ban any further use of asbestos globally. At the moment, there's extremely heavy use in Asia, still being mined and exported from Russia, Kazakhstan and Brazil, and arriving principally in Asia. The ILO and the WHO produced a document that we worked on called National Action Plan for Elimination of Asbestos Diseases, and we're campaigning in many countries to get that adopted.
Eliminating highly hazardous pesticides. Around 3% of agricultural workers suffer from acute intoxication from pesticides. There is no data available for chronic intoxications.
And agriculture, alongside mining and construction, is one of the most dangerous industries for people to work in. And there are many thousands of workers who suffer fatalities and ill health due to their chemical exposure. But the information we get from our affiliates is that exposure to chemicals, in particular to pesticides, is a major concern for many, many agricultural workers. We've been working for some time on a specific list of pesticides. It used to be called the Dirty Dozen, so the most toxic, some of the most damaging. Those included things like endosulfan and paraquat. Paraquat is widely used as a herbicide in many crops. It's banned here in Europe, but still widely used in developing countries. So this is our absolute priority at the moment. It is the most toxic of pesticides. Minimal exposure is fatal.
Eliminating the most hazardous substances is the only solution. When in countries like Bangladesh or the Philippines, less than 10% of pesticide users wear basic protective clothing. Workplace carcinogenics. At least 1 in 10 cancers are the result of preventable workplace exposure. Europe's trade unions are helped by their own safety think tank, the European Trade Union Institute, which focuses on carcinogenics.
In the EU, each year we have 100,000 workers that die because they are exposed to carcinogens at the workplace. So that's the first cause of death at work. All those occupational cancers and deaths are preventable. And the idea is to try to avoid having workers exposed to carcinogens. So the best way to do that is substitution. So the aim is to try to phase out those carcinogens from the market and replace them with safer alternatives. So we work a lot on substitution, and for that we monitor the implementation of the REACH regulation, but also the Carcinogens Directive.
We can make it happen. Many unions are fighting to eliminate toxic substances at work, to get strict protection from related risks, and to get justice for those harmed by toxic exposures. They will continue to do this as we move towards 2020.
So for the ITUC, these next 4 or 5 years will be critical in trying to outreach to all our union members so that they know that chemicals is a top priority for their health, for their lives, that a lot of public resources are actually going to be expended if we do not address this issue with prevention policies. Our priorities are also going to go into awareness raising.
Unions from different countries are working to protect workers. Globally, the IUF has trained farm workers on pesticides risks in many African countries. Results are remarkable. Those workers trained then managed to substitute most of the hazardous substances. They are much more aware of protective measures and are improving the statistics they record. Industrial and BWI are working on a campaign on zero occupational cancer. In Spain, the CCOO is following up this campaign nationally.
Actualmente mi organización, que es Comisiones Obreras de España, ISTAS, estamos llevando a cabo una campaña que se llama Cáncer Cero en el Trabajo, en la cual tratamos de mejorar las condiciones de trabajo de todas las personas que están expuestas a sustancias cancerígenas y sustancias muy peligrosas en el lugar de trabajo. En esta campaña tratamos de formar y informar a los trabajadores sobre estas sustancias, realizar una intervención sindical en las empresas para tratar de sustituir las sustancias químicas peligrosas.
The CCOO regularly trains worker representatives on chemical risk management. The union has a network of more than 120 advisors for union reps that have answered many thousands of queries related to chemical management. The steelworkers in the US and Canada launched a campaign to put breast cancer out of work by promoting safer alternatives to the currently used dangerous chemicals. In Uruguay, PIT-CNT is planning to train 50% of chemical workers and will obtain concrete results.
En el sector de la industria química, lo vital ha sido el trabajo que hemos hecho a partir de los sindicatos en cuanto a exigir en algunos casos el cambio de las tecnologías y en otros a establecer fundamentalmente medidas de organización de la producción que minimicen el contacto de los trabajadores.
But they are also working with other sectors and risks.
El caso fundamental de la contaminación con los agrotóxicos, que además ha generado problemas de contaminación del agua potable, problema serio para nuestro país. El tema pasa por alguna campaña nacional que se está haciendo en contacto con otras organizaciones para prohibir definitivamente el uso de esos. En principio, para establecer controles que no se han establecido sobre los límites territoriales de la fumigación, la distancia a los centros poblados y a los cursos de agua, pero en el mediano plazo la idea es tratar de prohibirlos.
Sustained labour projects in countries such as Brazil, Dominican Republic, El Salvador, Malaysia, Uganda or Togo have shown that change at the workplace is possible by building the capacity of workers.
We have been training, raising awareness and providing practical tools to union reps and to workers too in many different countries. Things such as where to find information on substances, risks, safer alternatives, prevention measures, and we have been also working with national centers, with unions at national level, in improving national legislation, its implementation and its compliance.
Moving towards 2020 is also about workers' rights. Firstly, participation and consultation. Workers demand the right to participate in health and safety programs, and this includes chemical management. Joint health and safety committees have shown to be an effective way to improve conditions. Secondly, the right to know. Workers must have the right to know the dangers of what they are using and their effects on health and the environment. Third and last but not least, the right to refuse. Workers must be able to refuse or stop dangerous work, and there must be legal whistleblower protection.
We need a great deal more information about chemicals, and we need to be part of any risk assessment and risk management process that's implemented to control chemicals. That's why workers need to be there and need to be a part of those discussions, fully involved, fully informed, and full equal participants.